So the other app we want you to kind of take a look at is actually GBON. So if you're a member of GBON and you hit the GBON and you've already downloaded it, again, you're going to have to go through email. And the email is just to make sure notifications and everything are going correctly. When you're in the GBON app, on the top, you see where the little envelope is on top. You're actually looking at updates, things that have come over that we're kind of want you aware of. It might be that mammography is available or just something occurred that we want you to know. The top one shows about a doctor, and when you open it, it takes you to our video documents where he's talking about chronic headaches and things that you may be encountering. It talks about our NCQA Accreditation for case management. GBON is the only one in New York State with NCQA Accreditation for the case management, in addition to 5-star quality metrics. And we're number 5 in terms of size. We have over about 8,000 lives. But here, we're giving you all that information. When you go back, on the left tile is the patient portal. Again, you can go into the GBON portal with your care manager and your PHN and sign in and really schedule appointments and ask for information, look at your records, and have more controls as to what happens. We're trying to set up televisits too. So through here, you can do a televisit, and you can have the Navigator connect us to the doctors or connect you directly to the doctor. When we come back here, there are 2 sites. So if you're part of GBON and you get some tests, they're important. We're going to do the Your Care Incentive, but here in the Your Care Incentive, if you meet the criteria for that, so if you need breast cancer screening over 40 years of age, then what ends up happening is you will get $25. So you improve your quality in terms of taking care of you. You fill out the forms, you send them in. We actually give you a number, and as a result of that, we give you a $25 gift card. So breast, adult exam, colorectal, diabetic exam, whatever you fit into that category. The same thing happens on the left side of Fidelis that we work with right now in agreements with them. We have what is called the PHN directory. So this is all the PHNs that are in our system. If you hit on that, you can basically come up here and search by who you want, or go down the list, and if it's this person that's your PHN, you can click on it, and by doing that, you can just make a call to them. So it's giving you at least access, because they're available either through the computers or phones during the time here, and it's an easier way for you to get access. Now, if you are calling to book transportation through the app, you just click on that, and it gives you the number. Is it transportation? Is it a nurse line? Or you want to talk to GBON? So if it's transportation, you click on that. Again, you make a call, making it very easy for you not to get lost in our system. If you want to find a doctor, you click, and these are all the doctors that are part of our system. So here, you can actually pick. I'm going to pick myself, Dr. Vasquez, and then the category that you want, which will be family practice. And then you say search, and what that'll do is actually find a doctor with their information and where they're at in terms of practicing, so that you can really know or get the doctors that are working together to get better care. The emergency lines are important, so if you click on the emergency line, one of the areas that you'll see is the numbers. We want you to have poison control numbers, suicide hotlines, and domestic abuse, and even heroin and opiate, because this is information that's valuable. So if you were to hit the suicide hotline, it would actually pop up the number, and you'll know exactly, giving you a little bit more information. Now the telehealth is built in because we have a nurse advice line. If you click on it, again, it's going to take you to our site and tell you what these nurses are doing, which is a lot of telehealth. They're handling a lot of calls, and sometimes you can see the doctor at home. You won't have to come in. We work with the offices to do that, to make it a lot easier for the things that you want to do, which often help with patient care. The other pieces of this is that we have health education on this side, and this just helps us to kind of get you information about what the health phone does and translations in many languages. Health Encyclopedia on the right side, it's valuable. It's giving you access to multiple different diagnoses. So you may want to find out, and click A, and then on the diagnosis, it may be asthma that we want to deal with. You come down, and the amount of information here is pretty good. So when you do the asthma, you're going to see this type of information, and you can actually go through a tutorial. by actually clicking the tutorial area, and the navigators can help you learn a little bit more about that. In terms of the community resource hotlines, if you click on that, you've got multiple different setups. The one that's really nice is if you go to the neighborhood navigator and you click on it, one of the things that you can do is if you put in your zip code, so if you're in the 14201, what ends up happening is it does a search. By doing a search, you're actually, so let's say you needed housing, you can click on housing. You need temporary shelters. By clicking on this, you'll actually go to what's available in the area and with the location, and you can call and get access to that. Again, providing that at your fingertips. We also put 211 Western New York homepage, which does a lot of the same things. So you can put the key areas that you want and really go into housing, health, domestic violence, mental health, services that you have around the area in order to make the patient better aware of the care that they can receive. Member services, since you're a member of GBON, it tells you all the things that you get in English and Spanish if you're with us, so that it often's really good to know what services we provide and why, and how protected the information is that you give us. So we do take that very seriously. We have a website that says About Us that you can link in here and really look at how do you make referrals, how do you really know more about GBON, and how did GBON do? I think it's important to know how these centers are doing, so we're giving you full transparency as to what we do. The YouTube channel has a lot of videos that we have, and we're talking about different things all the time. So if you have a few minutes listening to these videos, it's a wealth of information that you can get about our telehealth, about activities, about specialists, about what we want to kind of do in the community, that's quite important. The Medical Minute is actually specialists that are here that are giving you little video discussions as to what's going on. It could be on headaches, on mental health, but our doctors are trying to become a little more informed. The insurance button on the right side is just the different insurances that GBON deals with, but one of the pieces that GBON really focuses in on is wellness. So our wellness centers here, we have our fitness, we have nutritional support, and by actually clicking through these, we actually give you information that becomes valuable in terms of workout videos and information on your health that could become quite important going forward. All on the app, and it's all free. Patient feedback, again, we want you to tell us how we're doing and how we better do the things that we want to do in order to improve your care. In terms of, like I mentioned, GBON being the only case management accreditation, well, if you hit the NCQA component of it, it's a big accreditation, and we went through it just to show you that we really mean to improve your care. There's news that occur, and we like to kind of go out there and let you know about the different things, whether our doctors get a award or we're doing different openings and expanding so that you're keeping up to date. Our locations, if you click on this, you'll see the different locations that we have. And when you're clicking on that, you're going to get directions to these locations, which are real important in terms of how we care for our patients. And then updates is like when I told you that anything that's going on, that we try to push it out. So if there's a different program or service in the community, or things we want to make you aware, or it's screenings that are taking place, we actually put them in the update section. We're all over the place, so we're trying to link up and figure out how to best get your information. On the bottom of the tickers, if you see a doctor or information, you can click on it, and it'll actually bring you to the same site to hear a condition, especially heart failure, which Dr. Gales is doing here, that may change your life. So that's it for the app. Again, we put this together with a lot of work and effort to really make sure that you're getting the best possible services here at GBON. Thank you.